If you are trying to improve your sleep, or you're helping patients with sleep issues, you need to start with a sleep assessment. Let's see how to do this. There's a ton of information out there on sleep hygiene, but even if you're following those recommendations, you might feel like your sleep could still use a bit of a tune-up. If you are interested in learning more about optimizing your sleep and your mental wellness, then go ahead and subscribe to this channel where we talk all about science-based strategies to upgrade your sleep quality and your mental health. I'm Dr. Nishi Bhopal. I am a physician. I'm board certified in psychiatry, sleep medicine, and integrative holistic medicine. Every video also contains a tip for healthcare professionals. So if you're a physician or a healthcare provider, I invite you to get my free sleep mini course for outpatient physicians, which is jam-packed with practical, high-yield clinical strategies that you can use in your clinical practice today to help your patients optimize their sleep. The link to the mini course is shown on the screen here and is also available under this video. This is the fourth video in a 4-part series on sleep fundamentals. So if you haven't seen the first 3, you can go ahead and check those out after this video. Okay, why do a sleep assessment? Well, if you've been following my videos, you've heard me talk about looking under the hood for root causes so that you can address those issues that may be affecting your sleep or your mental health so that you can actually find lasting well-being and health. So when it comes to sleep, the first thing you want to do is do a sleep assessment to kind of look under the hood a little bit closer and see what might be going on. And if you could use a little bit more help with sleep, you can sign up for my 5-step sleep coaching program, the Holistic Sleep Reset. The information for that is under this video as well. Okay, when you're doing your sleep assessment, there are 4 main things that you can look for. And I kind of like this 4 pillars framework for assessing your sleep quality. So the 4 pillars are depth, duration, continuity, and regularity. Depth refers to how deep your sleep is, and technically this can only be measured with an EEG. Even if you're using a fitness tracker, a wearable like an Oura Ring like I have, it's not great at telling you how much deep sleep or REM sleep or the different stages of sleep you're getting. They're just not that accurate yet. But if you're not able to physically measure the depth of your sleep, you can pay attention to how you are feeling and how rested you feel in the morning. So that's pillar 1, is the depth. The second is duration. About 1/3 of adults are not getting enough sleep on a regular basis. Most adults need somewhere between 7 to 9 hours of sleep on average. This will vary between individuals, but if you're not getting that 7, 7.5, or 8 hours, you may not be getting enough sleep. And how you know if you're getting enough sleep or enough duration of sleep is if you find that you have to catch up on the weekends, or that you're dragging in the afternoon and you're needing extended naps on a regular basis, or you're just not feeling rested, you're feeling exhausted much of the time. That could be a sign that you're not getting enough sleep on a regular basis. The third pillar is continuity, which is how well you're able to stay asleep across the night. As I mentioned in a previous video, it's actually normal to have an awakening during the night or after a sleep cycle. That is perfectly normal. But if you're finding that you're having multiple awakenings every night and that you're having prolonged extended awakenings and difficulty falling back asleep, that could be a problem with continuity. Then the 4th pillar is regularity. Do you fall asleep around the same time every day? Do you wake up naturally in the morning around the same time every day? This is really important for your circadian rhythm. Even if you're getting enough sleep on a regular basis, if it's at drastically different times, like if you're a shift worker, or if you have a circadian rhythm misalignment where your sleep schedule is very different on weekends versus weekdays, this can take a toll on your sleep quality overall, and it can also have a negative impact on your physical health and your mental health. Studies show that irregular sleep schedules can increase the risk of depression, anxiety. Shift workers have a higher risk of metabolic issues like diabetes. They even have a higher risk of certain types of cancer. So regularity of your sleep schedule is just as important as getting enough sleep, getting continuous sleep, and getting deep sleep. If you're finding this information helpful, please go ahead and click the like button. Now you have an idea of 4 pillars to look at when you're assessing your sleep quality: depth, duration, continuity, and regularity. Next, start to pay attention to your levels of sleepiness. Check in with yourself about how sleepy you feel during the day. Ask yourself, how sleepy do I feel during the day? When do I start to feel tired or sleepy? When do I feel most alert and awake? You can even use a scale called the Epworth Sleepiness Scale to assess your levels of daytime sleepiness. If you're nodding off during the day, like while you're watching TV or even during a meeting, that could be a sign that you're not getting enough sleep or good quality sleep. So you've assessed your levels of daytime sleepiness. Next, you can consider tracking your sleep. And I recommend tracking for no more than 2 weeks, because if you're tracking for longer than that, it can start to create a little bit of an anxiety or even a little bit of an obsession about sleep, and that can be counterproductive. So track for no more than 2 weeks. Tracking does a couple of things. It helps you keep track of your sleep patterns, of your levels of alertness. When you're taking naps, you'll get a really good sense of how regular your sleep schedule is. Sometimes things are happening that we don't even realize until we actually pay closer attention to what our actual daily routines are. It can be hard to remember what time you went to bed 2 weeks ago. So tracking can give you a really good sense of what your sleep patterns look like. Second thing it can help with is actually can help to improve your sleep. For some people, the simple act of tracking their sleep, of paying a little bit closer attention to it, of making it a bit of a priority, can actually help improve their sleep quality. How you can track your sleep? You can do it the old-fashioned way with pen and paper. There are lots of sleep diaries out there that you can download as a PDF and print out and fill out for 2 weeks. You can also use a wearable if you have something like an Oura Ring or another fitness tracker. You can use that. Remembering that sleep staging is not totally accurate with these, but they can give you a good sense of your sleep patterns. If you find yourself getting a little bit preoccupied with the data, maybe you're getting a little bit anxious about it or even a little bit obsessive about it, then take a break. There is a phenomenon called orthosomnia, which is an unhealthy preoccupation with getting good quality sleep. If you find yourself falling into that pattern, take a break from tracking. You can even watch my video on orthosomnia to learn more about that. So now you've assessed your 4 pillars of good quality sleep, you've assessed your levels of daytime sleepiness, you've tracked for a couple of weeks. What do you do next? So next, as you move forward, you want to keep making sleep a priority. Focus on regularity, focus on getting enough sleep. You really want to pay attention to how you're feeling. This is the most important thing. You want to develop that awareness so that you really know how your body is functioning, you really know how you're feeling. Just start to pay attention and cultivate that mindful awareness. Then, if you're practicing all the things that you're supposed to be doing, you're getting enough sleep, you're on a regular sleep schedule, but you're still not feeling rested, then that's a good time to start to look under the hood for other causes. So you might want to talk to your doctor or see a sleep specialist for further evaluation to see what might be going on. Here is your tip for healthcare professionals. There are loads of sleep assessment tools that you can easily use in clinical practice. You can use the AASM sleep diary. That is a free PDF for download. You can email those to your patients or even print them out and hand them to your patients if you want to start tracking their sleep patterns. You can use the Epworth Sleepiness Scale in your clinical practice to assess for levels of daytime sleepiness. Again, that's a free PDF that you can download. You can use the Stop Bang questionnaire for assessing and screening for sleep apnea. You can also use the Pittsburgh Sleep Quality Index or the Insomnia Severity Index. In my free clinical sleep mini course for physicians, I talk about how to use some of these tools, how to interpret them, and how to work with some of their pitfalls, because with any screening tool, they're not perfect, and there are some nuances you want to look out for in clinical practice. So I talk about all of that in my sleep course for doctors. How is your sleep quality? Go ahead and let me know in the comments below.